Tobacco is addictive and deadly. There's no denying it. And what's really worrying is that we're seeing an explosion of tobacco smoking in new markets in developing countries, where in a few short decades, 80% of all smoking-related deaths will occur. Here in Europe, we're also seeing increases in female smoking, particularly among young females. Despite these worrying figures, we've come a long way in tobacco control in the past decades, including the almost global ratification of the Framework Convention on Tobacco Control. Once we smoked in airplanes, hospitals and restaurants. Today, this is no longer the norm. Is a Europe without tobacco within reach? Let's find out.
I definitely think action should be taken to make sure that there's safer environments available.
We will have less lung cancer, for example, but also that we will have less indirect costs to people that do not smoke.
I come from Slovenia, and they have changed a lot of things in the system throughout my growing up, and people definitely smoke less these days, so that proves that they have done the right thing.
It's nice to see that actually when there is laws to try to get it out of the public sector, out of the public sphere, it works, and it's really nice to walk around with that, because when you actually walk into a pub where it isn't banned, it's really nasty and you realise how bad it is actually for everybody around you.
So we've seen that young people, those who will be our leaders in 2040, support a tobacco-free future for Europe. Let's ask some of the world's leading experts how we get there.
If we want to get a tobacco-free Europe, we have to have political will, and we have to have a regional concerted action. We have some of the best performers worldwide in terms of achieving low tobacco use in their population, but unfortunately as a region we are on average the heaviest smokers of all WHO regions.
A tobacco-free Europe is certainly possible. It's purely a matter of political will. If the governments of Europe are determined to achieve it, they will.
Governments can really make this a priority by really thinking about what are the costs of inaction. One of the great and brave statements, I think, of the former Australian Health Minister Nicola Roxon was, she said, by not acting, we are killing people.
Do we have the policies? Well, it is for governments to really look at the mechanisms, and here perhaps the whole of society approach is really important, because the FCTC is not only a responsibility of the Ministries of Health.
We've done really well so far in tobacco control, and I think we need to recognise what we've done and defend it. It's easy to become complacent. We've stopped investing in tobacco control in many parts of Europe, and we've seen some slippage. So maintaining what we have and defending what we have is an ultimate first step priority.
In the future, make sure that there's enough funding and there is enough coalitions and partnerships in Europe, because without that, then the tobacco industry is having a playfield.
Specifically, we should be increasing prices. There's a great disparity of prices across. An increase in prices lowers consumption and generates the revenue to pay for other programs.
Effective social marketing campaigns. Many countries don't actually have to produce their own. We can now use each other's. We learn from other countries, we use their materials, we can adapt them to our own language, our own culture.
Pictorial health warnings. Some countries are even considering standard packaging. Another important best buy, we need to inform the smoker at the point that they are buying of the dangers that they are exposing themselves to.
The Ministers of Health really need to confront the tobacco industry. We need to have a war on the tobacco industry in the same way that we have had a war on the mosquito in the attempt to eradicate malaria. The tobacco industry is the vector of death and disease. We cannot see it as being any other industry. It's not.
The first step is to get this drive again, and we believe that the adoption of a vision of a long-term goal of tobacco-free can get politicians and heads of state again excited about the gains their populations can make.
We have adopted the so-called Ashgabat Declaration, which is the declaration that envisages a Europe which is tobacco-free. And we have a long way to go to achieve that, but it is absolutely realistic. We have to implement the measures first that are foreseen in the Framework Convention of Tobacco, but at the same time we also have to agree on the new vision on what we mean by the tobacco-free Europe. And we have to agree on the measures. We have to have public consultations on this with the involvement of the different sectors and the different levels of the governments and also the societies, including also the regional and the local levels. And we have to work out the measures on which we all agree. We have a unique opportunity now with this agreed vision with the governing bodies and with the member states and the regional committee to build a new generation that is free of tobacco and to envisage healthy children and healthy populations for the years to come.
We can and must do more. Support your government and the World Health Organization in striving for a tobacco-free Europe. It is possible, and it's the right thing to do, for us, for those around us, and for future generations. The tobacco epidemic, including the millions of deaths that result, is man-made and entirely preventable.